Hi, my name's Rebecca. I'm a level 1 nursing student. I was just wondering if I could follow you today.
Sure, absolutely. I actually just about to go in to see Mr. Light. Do you want a quick S-bar?
I do. Thank you.
Okay, so this gentleman is 67 years old. His doctor is Dr. Phillips. He was admitted for elevated blood sugar 5 days on a non-healing wound on his right heel. He has no known allergies. He is currently alert and oriented ×4. We're calm and cooperative. His head to toe came out fairly good. His skin is dry and mostly intact except for that right heel wound, which has some serosanguinous drainage. Listened to his heart and lungs, and he has S1 and S2 heart sounds and regular rate and rhythm. And his lung sounds are all clear in all the bases. With his GI and GU, we have a flat and non-tender abdomen. We have present bowel sounds in all 4 quadrants. He has no problems urinating. His pupils are round and reactive to light. They're accommodation. We don't have any extraocular movements. His mouth area is moist, the same with his nose. He has great muscle strength, 5 out of 5, in all of his extremities, and he's got palpable pulses and good cap refill both in the upper and lower extremities. We do have some labs pending. We have a CBC and a CMP pending. They should come back in later today, and a wound care consult. Currently, we are putting a moist dressing on that heel. His vital signs are all within normal limits, and we just took his blood sugar, and it's 290. So I'm going to go in and make sure he's got his dinner tray and give him his insulin.
All right, very good.
Do you have any questions for me?
I do. Why specifically is this client receiving this medication?
Mr. Light's type 1 diabetic, sorry. And he is getting Lispro to help with his insulin production.
Okay, what action does this medication have on the body?
This helps regulate carbs, fats, and protein, and inhibits hepatic glucose, which lowers the blood sugar.
When should you question administering this medication?
I would question this when the patient's capillary blood glucose was on the lower side below 60.
Okay. Does this medication have a therapeutic serum level?
There's no therapeutic serum level, but we do have an onset of 15 minutes and a peak of an hour and a half, so I would keep an hour to an hour and a half, so I would be keeping an eye on that.
Okay, which vital signs must be monitored?
I would monitor all of the vital signs on this patient, your temperature, your pulse, your blood pressure, and your O2 sat, and then making sure his capillary blood glucoses are done.
Which physiological parameters should be monitored when the medication is being administered?
Let's see, in the hospital, physiological would be your signs and symptoms of hypoglycemia.
Okay, what interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
In the hospital setting, I'd make sure that your documentation has the last site that was documented, and of course ask the patient. I would also make sure that we are making sure the patient's eating their meals and making sure that the glucose levels were taken before the meals and not afterwards. And that's about it for that.
What interventions must be taught for taking this medication safely at home?
I would make sure the patient knows about the CBG monitor and make sure he has one at home and that it's working properly. And I would make sure that he knows how to administer his own insulin. And then we would make sure he was taught on how to know his signs and symptoms of low blood sugar and make sure he always has a snack with him when that might happen.
What are the side effects and potential adverse reactions?
Mainly for this medication, it would be hypoglycemia. There's also a injection site reaction where you may get some redness and swelling.
Okay, how will you know the medication is effective?
I would know by the next blood glucose level being lower than the one we just took.
Okay.
All right, let's go.
Sounds good.
Knock, knock. Hello, Mr. Light. It's Melissa, your nurse. I'm here to give you your insulin before you have your meal.
Oh, good. I'm hungry.
All right.
My stomach's growling.
I see that we've got your tray already over there, so that's great. Okay, so let me get in here and see what we got going on. So it looks like we're going to give you 4 units of your Lispro or Humalog. Your blood sugar was 290. All right, can you tell me your name and birthday?
Mr. Glenn Light, 67 years old.
And do we have any allergies?
Nope.
Okay.
Sure don't.
Perfect. All right, so I've got my insulin Lispro, so I'm going to scan his armband here. Scan one more time. Perfect. Scan the medication. While we're doing that, we're checking to make sure we have the correct medication with the computer, and it's the correct ordered medication, and we have a correct expiration date, and it's the correct time. All right. Alright, so I see in here that they gave you your last injection in your left upper abdomen. Is it okay if I go into the right lower abdomen? Okay, so we're going to clean this off here, this top. Put up our syringe. Okay, so we are going to pull this back to about 5 of air. And I'm going to put in the air first. Flip it over. Get to right about 5 because you are going to get a little bit of an air bubble. Do our one-handed cap method. There we go. And then I'm going to bring this up to 4. Get that air bubble out of there, and that looks great. Okay. My gloves on here. Clean you off here. Very good. And 1, 2, 3. Perfect. Short the container we go. Okay. I was reading in the doctor's notes that you want some education. So for your discharge, I'm going to have these in your packet, but I'll give them to you now. This is a little education on Lispro. I know that you take that at home, but it kind of gives you a little bit more about what the medication does and things that you can look for on that medication. And I also printed some education on diet, and that's about carb counting.
Carb counting, yay.
Yeah. Alright, let me just document my site here. Okay, do you have any questions for me right now?
I think I'm good.
Alright, let's make sure that you get your tray close to you and we will get you out of here, okay?
Okie dokie.
Get out of your way so you can eat. All right, do you have any questions for me?
I do. Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, I reviewed the patient's allergies. I double checked the blood glucose level more than once, and I made sure that the patient had food in the room before administering the insulin.
Did this information affect your decision to administer the medication?
It didn't affect my decision. The doctor's orders did state that if his blood sugar was 290, that he was going to need a sliding scale of 4 units.
Okay, did this information affect how you administered the medication?
No, the insulin for this insulin is administered sub-Q, so that's what we did.
All right, well, thank you very much for your time.
All right,
I
thank you.
appreciate it.